Shin splints, or medial tibial stress syndrome, is a common condition, especially in individuals who perform frequent jumping and running activities such as dancers, runners, and military personnel. Shin splints is described as a dull, aching pain along the lower two-thirds of the lower leg in the inner and back portions that is often aggravated with activity and decreased with rest. Shin splints are not well defined in their cause, but it's most likely due to an aggravation of the anterior and posterior tibialis muscles and a further aggravation and irritation of the periosteum portion of the lower leg bone called the tibia bone. Shin splints may also be considered on the continuum of a stress fracture reaction because the most common complication with shin splints is a stress fracture. To be given a diagnosis of shin splints, it's important that muscle hernias, lower leg compartment syndromes, and stress fractures are ruled out of the causes of pain. Stress fractures in particular are usually localized pain that is less than 5 centimeters in diameter versus shin splints is a more widespread diffuse pain along the lower leg. Multiple factors may put an individual at risk for developing shin splints. These risk factors include the presentation of anatomical bony malalignments such as ankle overpronation, abnormal hip mobility, increased BMI, overuse of plantar flexor or dorsiflexor muscles of the ankle, and a previous lower extremity injury. Females in particular are at an increased risk for the development of shin splints, especially females who have a lower calcium intake in their diet. A sudden increase in exercise intensity, frequency, and duration, and limited previous experience with this type of exercise also increases one's risk for shin splints. Finally, exercising on hard surfaces or using inadequate footwear places someone at the risk for development of shin splints. There are multiple strategies to help prevent the onset of shin splints. It is important to implement a proper physical strengthening program, especially of the hips and down, and to perform cross-training activities to improve the overall strength and dynamic abilities of the body. Having an adequate diet, wearing appropriate footwear to provide individualized support of the ankle, and performing proper warm-up and stretching activities is essential to reducing your risk for shin splints as well. Finally, implementing a reasonable and slow progression with exercise intensity, duration, and frequency helps to reduce the onset of shin splints and pain of the lower extremity. If shin splints have already developed, the condition is usually easily managed. With proper treatment, about 70% of people return to their prior level of function with no pain at all. However, if symptoms persist with conservative treatment for over a year, then surgery may be considered. Treatment for shin splints includes ideally active resting for upwards of 4 months if needed, then a gradual return to your exercise. Active rest means that you're taking time away from the activities that are aggravating to your pain, but then replacing these activities with other ways of staying active, such as biking, swimming, and yoga. Physical therapy treatments are also known to be beneficial in reducing pain levels with shin splints. Physical therapists are able to reduce shin splint pains with proper strengthening, stretching, hands-on manual treatments, posture assessments, running assessments, and footwear assessments, and guiding the athlete to a gradual return of sport.